Of all the things that I work with in postpartum pelvic floor, the thing I get the most questions about is pelvic organ prolapse. I get the most DMs about, I get the most messages. Hands down, that's what moms fear the most. And to be honest, it makes sense, because you Google pelvic organ prolapse and you see pictures of organs exiting the body and orifices and that sort of thing, and it freaks you out, right? Sometimes I have moms hop into my DMs and they say, okay, I didn't know this until my OB said something, or my pelvic floor therapist told me I have a prolapse. And then I looked and now I see it, and I, what do I do? Should I do something about it? And my first question back is, did you notice anything before they told you? And there's a very particular reason that I asked that question, because in a lot of cases, you might be seeing that provider for something completely different, and very innocently, that provider says, oh, you have a little bit of cystocele or a little rectocele, and then you go down the Google rabbit hole and freak out, and then all of a sudden it's a thing. With prolapse, and I've said this before, what you see, the severity, the grading, doesn't always equate to symptoms. So you can have, the example I always give are women that I can examine them in any position and I can't find a darn thing, but they feel it all the time, versus somebody that they come to therapy and want me to take a look and see what's going on. The only symptoms they're telling me is they have to stuff something back in. Usually it's an organ, but they don't feel any pressure or heaviness or things like that. And the only way that those two worlds can exist is if what you sense, what you feel, your sensitivity, doesn't necessarily equate to the severity or the grade. And there's still a lot we don't understand. I think even more recently, we're considering the role of muscles that are too tight or overactive. Does that increase sensitivity? Who knows? But here's the thing. Just because someone says, I see this, and you didn't have any symptoms before, don't worry about it. And I'm being totally honest. And chances are, if you're seeing a provider for something else, it'll probably help either way. But again, like I say this to patients, I'm like, would you have paid attention? Would you have known had they not said something? And the answer is usually no. And in that case, you're in that situation where your brain doesn't deem that information important enough. It didn't tell you, but now that you're paying attention, now that you're hyper-focused on it and there's a fear component, you're probably protecting, guarding, and being super aware. Now, all of a sudden, it's an issue. The good news is there's a way to walk back from that, but it all comes back to kind of understanding that what we see doesn't always equate to what you feel. And that's, again, why you have some clients that they're just super sensitive. They feel something there, they swear something's there, and then the OB looks or the PT looks at, no, I don't see anything, which now your symptoms aren't validated. You're totally freaked out because you're trying to get somebody to believe that you feel this, and you totally do. And then also the person that you didn't feel a darn thing, and somebody's telling you that you have this big, awful thing. And so I think that's why there's so much fear, so many questions, because it's not a linear pathway. We like when A equals A and B equals B. And if you do this, this will happen, and we know what the result is. And this prolapse just isn't like that. Prolapse symptoms have their own characteristics. They have their own patterns. We can have different ways we get there. So you and I might have the same, feeling, but maybe my mom had prolapse and your mom didn't. So I've got some genetic predispositions. My mom didn't, but I still had prolapse. Maybe you had a forceps delivery and a lot of tearing, and maybe you had a gigantic baby, and maybe I didn't. But the patterns don't always, aren't always super clear. I mean, people, I think I quoted an article a number of months ago that's saying preventative measures to prevent pelvic organ prolapse included C-section and smoking. And I'm like, all right, we got to do better than that. I had 2 C-sections, and have a little bit of cystocele and some rectocele. Granted, I had a big kid and I got to push on my first, but it's complicated. And again, we're not good with complicated. We like it when it's a linear path and we know what to expect. I like when people bring all that information. It's my job to find that pattern. Okay, what did you walk into that pregnancy with that maybe put you at an increased potential for having prolapse issues? And it isn't always heavy lifting, by the way. What happened to you during pregnancy? What happened to you during the delivery? What happened to you in postpartum? All of those different parts and pieces come together to make, I always refer to it as like a recipe, and figure out what the ingredients are and what the quantity of the ingredients are. Like, is this truly a genetic issue? And I can't really do that much about it. So we need to look at more supportive structures, like pessaries and things like that. Or is this something truly that you had a traumatic delivery and, suction or, a lot of different things that truly resulted in trauma, that was truly the origin of the prolapse. And so again, it's great. But I see so much hope in that, because if it's one thing and it's something I can't do anything about, then you're screwed. Sorry, I can't help you. But if it's a lot of little things, what if I do a little bit here, a little bit here, a little bit here? What if we impact this? Can we scrape off the edge enough to make an impact so that you don't have symptoms anymore? And that's why I think there's a little bit of an art to working with pelvic organ prolapse, because you have to understand the nuances. You have to be aware it's multifactorial, and then be able to kind of go down those different little rabbit holes to come out with this nice result that ultimately is less symptoms and doing what you want. But again, we're not good with complicated. We're just not. And frankly, if you're a mom, you don't have time for complicated. You just want it to go away. So if you are that person that's sitting on the fence and you're like, I think I did all the right things, did all the basic stuff, I'm still not sure what to do here, send me a message. I'm happy to kind of navigate and help you find resources, chat through with you. If you're that person that you're like, okay, I had no idea I had this, I have no symptoms, and somebody just told me I had this, and now I'm totally freaked out, let me know that as well, because again, we need to kind of walk back from the cliff. And as providers, we need to understand that our words have value. If the first thing I'm going to do is go see a nasty picture of a prolapse that really doesn't look anything like mine, but that's going to send me into this super, guarding hypersensitivity, that could, make symptoms where previously there might not have been. So again, it's a little complicated, but if you've got questions, happy to answer them for you. You can always hop in my DMs, because again, that's the one thing I get. There's when you've got nuances and, complicated factors, that's where the questions lie. So ask them. Thanks.